All right, good morning, everyone. Welcome to the council meeting for the Township of North Kawartha. It's a beautiful September 16th up in North Kawartha here, and I'd like to welcome those folks that are joining us in real time, either in person or online, as well as a welcome to those folks that may be watching this at a later date and time, because as most people know by now, we do record our meetings and upload them to our YouTube channel. So just a notice to folks that any comments or opinions that are expressed during the meeting will be recorded. Okay. And before we get into the business, council would like to acknowledge that we meet on the traditional lands of the Anishinaabe, in particular, our neighbors from Curve Lake and Kawartha Anishinaabe First Nations. We recognize and honor the original people of this place we call North Kawartha. As duly elected representatives, we follow this Indigenous practice of acknowledgement to foster respectful deliberations, thoughtful collaboration, and wise decision-making in our service to this community. And with that, I would ask, does any member have any interest with any of the matters before us today? I don't see any, so we will move on. And adoption of the agenda. I don't think we have anything to add on to that. So I need a mover to adopt that. Moved by Jim O'Shea, seconded by Ruth Ann. All those in favor? Our agenda has been adopted. And no statutory public meetings here this morning. So we'll get right into our presentations. And I'm very pleased to welcome with us this morning virtually. We have Duff Sprague, CEO of the Peterborough Family Health Team, and he's here to give us an update as well. And I see Catherine Ward is here too. Is she your partner in crime on this stuff?
She's our primary care manager. She's been with us about 6 months.
Wonderful.
Really happy to have her.
Okay, well, wonderful. Welcome to you both. And I'll turn it right over to you, Duff. Go ahead.
Okay, is there a time limit you would like me to stick to?
Typically, it's about 10 minutes that we have for, but I mean, you know what, we don't have a lot on the agenda, so I don't want to say you can have 2 hours. But
Okay. I don't want 2 hours.
No, but you know what, for the most part, I'm sure there'll probably be time for questions and stuff like that. So don't feel that you're under any time constraint whatsoever.
Okay, I'll first off start by saying what a family health team is. It's a little bit of a complicated model. The family health team has no doctors. We have clinical staff, including nurse practitioners, and we have administrative staff. Our Peterborough Family Health Team is among the 5 largest in the province. We have 100 staff approximately, 100 full-time, I should say, and 71 are clinical and 29 are administrative. Our relationship to the physicians is an affiliation. Our services are to support the physicians and the physician rosters for the most part. There are right now, I think we have 87 family physicians affiliated with the family health team. And when I came here 5 years ago, it was 108,000 rostered patients. It's now 99,000 rostered patients. So it's clearly going the wrong direction.
Mm-hmm.
There are 5 physician groups. We call them FOs. 4 of them are in the city of Peterborough. 1 is somewhat in Peterborough and also in the surrounding areas. As you know, you have Dr. Hassan in your community, who is part of that FO that is spread out a little bit. We also support what's called the Partners in Pregnancy Clinic. So that is the 6th group that we work with. Our board of directors is made up of 7 family physicians, 3 community members, and then we have some non-voting members who sit on that committee as well. I want to go through the allocation process because how we allocate our resources to the doctors and their clinics. We do it primarily based on patient numbers. The more patients you have rostered, the higher percentage of our rosters support you. Now, it's a complicated process, so we only do the reallocation every 2 years. As you can anticipate, the different physician groups, the rostering numbers go up and they go down. One loses a doctor, another one might get a new doctor, so we have to adjust the resources that we put between the growing and the shrinking. We allocate it by number of patients, and how it's distributed in support of the individual doctors who are their members. They determine how it is distributed amongst their members. So we decide what a physician group gets. They decide how their physicians, what support their physicians get. So it's a kind of a two-step process. I will tell you, this may not come to us as a surprise to you. We have huge hiring challenges right now. Our staff had not had a wage increase in 7 years. We have fallen so far behind other sectors, and our recent wage increase, which came this year, is 3%, and is not, I don't think, going to make a big difference in the number of clinical and administrative staff who apply to work with us. Nowhere has that hiring challenge been greater than in your community. Of course, you already know that. But I want to let you know that that is across the board. We used to get 8 NPs applying for positions. We're now down to 2 if we're lucky. And I think that that really has a lot to do with the way primary care is treated in this province. Now, your county, the Peterborough County, has hired new recruiters. I don't know if you're aware of that or not. You may be, but they've gone with a partnership that is George Smitherman, the former Minister of Health and Deputy Premier in this province under the McGuinty government. I was a director at the ministry when George was the minister, and Sherry Hudson, who is a former executive director of the family health team in the Brockville area. So they are now the recruitment entity for Peterborough County. I spoke, as you know, or as I've shared with you, we've had that NP position for your area. I think we've had it posted for 3 or more years, and we've had no applications for that. Now, that flips back to where the physician group gets to decide the reallocation amongst their doctors. I don't know what they're going to do with that position that can't be filled. They may choose to put that NP in another area where they can fill the position. I don't know. That is their decision. But I spoke with Dr. Hassan on the phone to let him know that we were presenting to council today. And Dr. Hassan knows there's been a change of leadership in his physician group. He knows that the leadership and the doctors decide the allocation of resources. And Dr. Hassan and I spoke about trying to get a second physician into your community. And I can share with you that in the recent physician negotiations with the ministry, I just received notice that physicians working in your rurality index score, which is 55, any community above 40, their doctors are going to get a 30% compensation increase. So I put that on the table because hopefully that may help recruit a physician to more isolated communities. So Dr. Hassan would welcome a second physician into his clinic. I have to say that we cannot just put a nurse practitioner or any staff up there independent of the doctor. All of our resources have to be connected to the doctor roster. So his 1,200 patients, if an NP ever applied for the job and won the position, and he has his 1,200 patients, it would still be his choice to keep it at 1,200, or because the NP's there, make it 13, 14, 1,500. That he would have the autonomy to do that. Now, we have 2 unattached patient clinics in Peterborough, and they are staffed by, we have some staff, and a nurse practitioner, some RPNs, some administrative staff, and we use fee-for-service doctors in those clinics. Recently retired doctors who will come back and work a couple of 3, 4, 5 days a month. New doctors feeling out the community, doctors who are waiting to join a physician group. We've been very successful with that. Now, I know that Peterborough is not easily accessible to your community, but I did want to go and check the numbers. And the numbers are not impressive. It's not being significantly used by your community. In the last 12 months, 45 individuals from Apsley have used the clinic for 109 encounters. So that's over a 12-month period. I wanted to ask you, and I'll leave that to the end. I want to ask you, as far as you know, where do people go in your community for care? I want to add that at last count, and this is probably a soft number, In Peterborough and Peterborough County, there are 26,000 people without a provider. Unfortunately, despite what the government is saying, it is my strong opinion that is going the wrong way. We are aware of other physicians who are on the cusp of retiring. So then you can take 1,200 and 1,500 people and add them to that list. I wanted to make you aware that there's a new community health center in Peterborough, in case you're not aware of that. They have a mobile component to their center, and that is an NP who's going out mobily into communities. And I've emailed the executive director to see if Apsley could be one of those communities. So I'll wait to hear back from the community health center. But they are doing that, and in a community health center, the NPs can work independently. They don't have to have a physician rostering or anything like that. So it's quite a different structure. And I guess that is about everything. I hope I didn't go through it too quickly. I am curious if you know where your community goes for healthcare, primary care, and other than that, I don't have anything to add except to answer any questions you may have.
Okay, wonderful. Thanks for that update, Duff. That's a lot of good info in there. Everybody's furiously taking notes. So I'm sure there's going to be questions as to your question about where folks go, and I'll certainly open it up. But personally, I mean, I have a doctor that I've been with for a number of years in Peterborough. But I will say when if there's issues that arise and I can't get a hold of my doctor, or it's not convenient for me to go to the after hours clinic in Peterborough, I'm in Bancroft. Bancroft is, 25 minutes up the road for me. And, I've received excellent care up there. And this is the challenge. And it's, but if there's something that is ongoing, then all of a sudden it's like, you're going to Belleville, you're going to Kingston. There's a real challenge with the way sort of the I don't know if they're still called LINs or whatever, but the way that they're laid out. And,
You go to the hospital for your primary care, or is
yeah,
there
I'll go to the hospital for sure.
Okay.
I had pneumonia back in December, really badly, and I was at the Bancroft Hospital a couple of times because there was no way I was going to get the care in Peterborough and not get it as quick, for sure, right? So I had to do what I had to do, right? But I just want to ask, like, sort of other members of council, because I know some people, like our seasonal residents who are up here full time, they've kept their doctors in the city. And they'll still go back to Toronto or anywhere in the GTA. Dan?
I'm split all around, right? I have a chronic condition, so I have a lot of, I have some in Oshawa, one in Scarborough, Peterborough. And if I have an urgent issue come up and I can't get into my doctor, because I do actually go to Dr. Hassan, I go to Bancroft or Peterborough. Hopefully Peterborough, because it will connect me to most of my appointments, but Bancroft is a lot easier to get in and out of.
Yeah. Anybody else? Colin?
I think the easier that it can be made to access healthcare, the better, certainly.
Yeah.
The two resources that I refer people to constantly is I actually work at the local pharmacy, so this is something that actually I see, are the PFIC clinics, the ones, the two that you mentioned earlier. But it sounds like they're not being well used, and I've given out that address and phone number hundreds of times. But the one that gets very, very well used is the East Region Virtual Care Clinic. And that is one of the very few that's OHIP covered. I do believe there's some penalty for the family doctors using OHIP.
They're actually removing that penalty just in the new negotiations. Sorry to interrupt, but they are removing that penalty.
That is good to hear, because that is a very, very well used resource in the community, especially for visitors and people that don't have access to their family doctor.
Okay. Anybody else? Jim?
Hi, Duff. Haven't seen you for a lot of years now. Since you first started, I think you big one.
Been a while, yeah.
Anyway, I don't have a doctor here either. I have my doctor in Lakefield. It wasn't Peterborough. Now I have at the Morton Clinic, and my cancer doctor, of course, is in Peterborough. But everything I go to, where there's a bunch of people talking and it goes into healthcare, everybody wants to know why we haven't got a nurse practitioner. And I'll say this not being sexist or anything, but mostly females, obviously, that are asking me, we would even, we've even discussed here, Duff, building onto the clinic to put a nurse practitioner in independent of the doctor, but from what I could hear, you won't allow that.
Yeah, not in our rules. The resources are dedicated to the roster of the physician. And the hope is that if a physician is working with a nurse practitioner, the physician will roster more patients, that they will grow their patient load. So the hope would have been, if we found an NP for your community, that Dr. Hassan would have added patients to his roster. But he is autonomous in that decision. We don't make it for him.
Yeah, it's still interesting. Oh, sorry, I just wanted to jump in though, because when you made that comment, but to go back, because you did say you had spoken with Dr. Hassan and he is open to the idea of having another doctor come in. And I think that's a change over, the years that we've been sort of, looking at the issue when it comes to healthcare in our community. So I think that's a positive. And I think that you would find certainly the folks that are kind of scattered and going all over the place, if there's, an option to, to be, another option to stay in our community, they would take it. Sorry, Jim, I didn't mean to.
No, that's fine. You did say, at one time that, you've already sent 4 nurse practitioners up here. You're not gonna send any more. I don't know whether that still stands or not.
No, that does not stand, because we had kept the posting going. There was a period of time, and it certainly had nothing to do with the community. I don't want to get into the details necessarily.
Yeah.
No,
but,
I don't want to either, but.
As an employer, I felt like we could not do it for a period of time because of responsibilities we have with staff, et cetera. So, but we very shortly thereafter started posting again. And we've had, as I say, in 3 years, we've had 0 interest. It's the location, maybe, maybe NPs have said it's a tough place to work, or, I mean, who knows what NPs are saying in the NP world about, I'm sure they talk about every single community and the doctors in it and everything else. So,
Yeah.
Yeah.
Yeah, but what you're saying is, I mean, it isn't a surprise to us. I mean, North Court, we get our location. We struggle when it comes to trying to, hire, municipal staff and those kind of things. And a small business owner, a lot of our staff come from away as well. So we recognize sort of even the geographical challenges when it comes to that. But that being said, it sounds to me from just what you've brought forward, though, there's maybe some opportunities or some things that we can look maybe to work on a little bit more. Opportunities if the timing is right, maybe we can get another doctor in here, but Colin, you had your hand up.
And I hate to jump back in the conversation here, but I may have misunderstood something. So within your structure, if we had additional space either within the health center or elsewhere in the community, and another physician were to come in, would they be able to independently roster their own patient load?
Oh, absolutely. What they would want to do is they would want to be welcomed into the physician group, the same group that Dr. Hassan is in. But the independence of family physicians stands. They can have 500 people, they can have 2,000 people. That's their call. They can work with an NP, they can choose not to work with an NP. They have a lot of autonomy in how they run their practice. But where we're stuck is that our resources are attached to rostered patients, with the exception of the unattached patient clinic. So, again, if you have a physician who you attach an NP to, and they only want to increase their roster by a couple of 100 people, that's their call. It may have an impact every 2 years when we reallocate resources, but 2 years is a long time. And the reason we wait 2 years is it's a big, provocative process to take away and give. So,
Yeah. Jim.
Yeah, Duff, that doesn't stand for a nurse practitioner, though. A nurse practitioner, we can't set her up privately and roster her own patients and so on.
An NP could work for a municipality. An NP could be independently working for somebody else. NPs do not have to work for doctors. There are privately, some doctors have hired their own NPs. I'm sure some municipalities have hired their own NPs. That is always a possibility. And then that NP can have their own roster of patients. It does not have to be affiliated with a doctor. Only if they're employed by the family health team does it have to be affiliated with a doctor.
I can just add to that for context is that NPs currently don't have the ability to bill OHIP. So they have to work under a salary model. There are potential changes coming to that in the new year. We don't know anything about what that's possibly going to look like, but that's the limitations currently with an NP.
Yes, thank you, Catherine, because if you hired an NP, you would have to have a salary for that NP.
Yeah. Which sort of changes, the game on many levels. And we know with our, our neighbor or colleague municipality, Norwood, and what they've done down there in that model. And, you know what, it opens up a bunch of, I think opportunities, but also some challenges as well. And it's also then creates a bit of a unlevel playing field, right?
Personally, I am very upset that things have been set up so municipalities fight municipalities for limited resources. It's unfair from a tax-based perspective, and the government is supposed to pay for these services. Municipalities shouldn't have to. So I am quite upset about that.
Okay, well, yeah, as I said, we're, but at the end of the day, I think, the challenges that each community faces, they're trying to figure their way forward and the best way to deal with it. But I hear what you're saying, and and it's definitely that's a fact. One of the things, and I'm just going to put it out there, I think, we talk about it, if you can have whatever you want, whatever kind of a model, forget all the rules and what's established or whatever. I've often said this is that North Kawartha, is in a unique situation with, we have a small permanent population, but a huge seasonal population. And we have a lot of doctors that cottage up in North Kawartha. And I just think, wouldn't it be amazing if you could develop some kind of a cooperative or something like that, utilize our existing resources, the human resources that we have to create something, like I said, it's just a made in North Kawartha approach where, the physicians that are here, could we create some kind of a healthcare system that would, capitalize on them? And I don't know if you could ever see something like that happening, because they've all got their own little sort of, their groups that they're with. But I mean, and I think there's a lot of communities in sort of the same situation as North Kawartha that, man, if the rules could be changed, like, we would be overwhelmed with doctors. But anyway, go ahead.
The reason we use fee-for-service doctors in the clinic, the unattached patient clinics, we don't have to go begging the ministry for money. If a doctor bills fee-for-service, they get paid, full stop. So if you had something in your community that was set up for those seasonal physicians that come in and bill fee-for-service, it might be of interest to them. We cover the RPN, and we cover the billing cost, and we cover the overhead. And they come in, they pay 10% of their fee-for-service billing for probably a lot more expensive services. But in the long run, it's less expensive for us because we're not paying the physician's income. That's covered. So I wouldn't toss out the idea, if you have space and support, making it available to those seasonal physicians to come in and do some work. Some of them might like to make a little money once or twice a week while they're vacationing.
Maybe they'll stay longer.
Yeah.
Right. So, okay. All right. Well, we might be talking a little bit more about that. I might need some more info, but Jim.
Catherine, you said that things are going to be revamped in January.
We're expecting April next fiscal year, potentially some announcements. Yeah.
Can you keep us in touch with that in case there's something does change on the nurse practitioner front, or because it would sure be the solution here if we could do it, but not the way you're saying it has to be done, but independently could be good work.
Yeah. Can I ask another question? Oh, sorry. Go ahead, Catherine. Did you want to respond?
No, I was just going to say absolutely.
Okay, perfect. You mentioned, Duff, I think you said 26,000 people in the county without a doctor, and that is not including the city, right?
That is
Do you know-
including the city.
Oh, that is
And-
including the city.
And
Okay,
I think it's a low number, frankly, you know, as I've shared,
I
we've
think so.
lost 9,000 in 5 years, so.
yeah,
I think it's a low number.
yeah, I think so too.
You say 26,000?
26,000, and that's city and county. It doesn't seem right. I know we're all kind of going, nah. But it's a challenge trying to gather that
Well, the
information.
Ontario
So,
College of Family Physicians says 30,000 for our area, and they say it will
Okay.
double by 2026 if something significant's not done.
like by next year, it's going to double.
By the end of next
Wow.
year, they say it will double.
And that maybe what due to like retiring physicians, that
Oh,
kind
yeah.
of. Yeah, but that's the challenge. Colin.
And
just
the
to go back-
young doctors take smaller patient loads too. That's the other thing. So you have your 1,500 patient doctor leaves.
Yep.
The new doctor wants 700. So that's one of the
Yeah.
challenges as well.
Yeah. Okay. Colin.
And actually, that's the question that I was gonna ask, is obviously we can't force work-life balance onto a doctor. But is there anything we can do to reverse that trend? Because that is concerning and it's gonna take more and more resources to continue to cover the holes that are left.
Is there anything you can do about the retiring or about larger patient loads for the new physicians?
About, I would say specifically the fact that new physicians aren't taking on larger patient loads and are instead restricted to doing sort of subspecialties for 2 days a week or something where they can do different billing.
Well, you know, I'll give you an example. It's the inequity of funding that this government does for family medicine. Their overhead cost, you know, because they pay for their own offices, their nurses, et cetera, has gone up 30% in the last couple of years, and their revenue certainly has not. So new grads are going too much work, too little money, too long a commitment. I'm making a multi-year commitment to these people. So there's so many variables, but if they could change the revenue, reduce the number of paperwork. I mean, every hospital wants things in a different format. We know all the reasons. I've got one of my doctors told me that she works half-time as a hospitalist just to keep the lights on at her family practice. That's how much more she makes as a hospitalist than she does from a family practice. And yet, I'm sure we all think family practice, a robust family practice, is the way to keep people out of the hospital. So we're spending money in the wrong direction.
It sounds like it. Anybody else?
Yeah.
Yeah, go ahead.
And
Carry
this
on.
is taking a step way back and generalizing things, but are you able just to briefly describe the relationship that PFIT has with municipalities, counties, when it comes to attracting resources?
I think that, you know, they've struggled a little bit, like many municipalities across the province. Peterborough has a physician recruiter, and as I say, the county has just picked up a relationship with George Smitherman and Sherry Hudson. We'll work with them as closely as we can. I mean, we're at their disposal. Whatever they want from us. We're meeting with the physician recruiter for the city this week to make sure that when they're talking to potential doctors, those doctors understand that in diversity of practice, which they all want, consider the unattached patient clinic. I mean, have your family practice. If you want some diversity, come and work in the unattached patient clinic. People are appreciative. Our staff are nice. There's very little overhead for you. So we're really trying to encourage that. And George Smitherman is working with me on a presentation around it anyway. So George is quite well versed in what we're trying to do. We're trying to turn the unattached patient clinic into a mindset of it's a patient attachment clinic. And we're going to encourage our physicians to roster from there because there's going to be a medical record that starts getting built. These people will have had episodic care. A lot of the front end work will have been done. So that's really the way we want to go.
Okay, any other questions or comments? Yeah, go ahead.
The final one here, and I feel a little bad because it's something that community lost when actually I moved over to the pharmacy. Blood work. That is important for a family physician to be able to have to sort of properly treat their patients. But it is a heck of a hassle to get blood work done if you're local, especially if you don't drive. I know a lot of community care resources locally that should be used for driving people to medical appointments or now being used for blood work. Is there any way that we're able to attract that resource back in the community, have a shared resource amongst a few communities that are struggling with that? Because it impacts the level of patient care locally.
Well, Catherine's got a clinical background, so she can correct me if I'm wrong here on the rules, and maybe she doesn't know the rules. But if your community was able to hire a phlebotomist, an RPN to draw the blood, then your challenge would be getting the blood to a lab. But they're not certainly life labs. Dynacare is not going to probably open up a lab in a small community because they're for profit. But as I say, if you could hire a phlebotomist to draw the blood, whether community care could transport it or any other avenue. I don't know what other very rural communities are doing about getting blood work, but I certainly can understand the challenge that you have. Catherine, would you have anything to add on that?
Yeah, there are several communities that are actually part of the Greater Peterborough FO, which Apsley is as well, which do privately have RPNs to do phlebotomy for them, and then they are able to coordinate Life Labs or Dynacare pickup from that. So there is the opportunity to explore those kinds of options.
Where would the closest Dynacare and Life Labs be for this community? Probably in the Bancroft area. Would I be correct?
Bancroft, yep. Bancroft, or in the Peterborough next.
And then Peterborough.
Oh, Peterborough paramedics.
Oh, what about, Peterborough paramedics or community paramedics?
Yeah, the community paramedics, I think, do limited blood work for the people that they see.
But you need to be like kind of rostered with
You
them,
need to be rostered with
right?
program.
Are they coming into your community? I just met with community paramedics yesterday, and they have capacity. They were telling me that they have capacity to look after more people. So that's interesting.
Yeah, there may be an opportunity there for sure. Jim?
Duff and Catherine, there are qualified people in pharmacies, and they seem to be handing things down to pharmacists that weren't there before. If somebody was qualified in a pharmacy, could they work with you guys to set it up, or is that out of your jurisdiction?
Well, to set up what?
I'm talking just the blood work here.
Yeah, the blood work from a pharmacy would have really nothing to do with us. It wouldn't be part of our mandate. And, as I say, our resources are pretty restricted to supporting the 5 physician groups, patients, and the Partners in Pregnancy Clinic.
Back to Colin.
I think this is my final question here. But we often get told that it's a if you build it, they will come type situation. But I struggle with that when I go down Highway 28 and I see that there's been vacancies at the Morton Clinic, which to me, proximity to an urban center like Peterborough, being right on the highway, it would be an attractive place to fill. But I also do see communities that are building new health centers, attracting physicians. Are you able, I don't know if you are able to, but can you describe if it's a human resource or physical resource issue locally?
Well, there's certainly a human resource issue across the province. There's not enough doctors practicing comprehensive family medicine by a long shot. But I think it's also some communities have made it very revenue appealing to come in, like Norwood has, and it doesn't cost the physicians much to have a nice clinic to work in and a pharmacy right next door. I've been out to the clinic. That's one of the things. That's where it's so inequitable that communities with a larger tax base can choose to spend their money in that fashion. And of course, the less a doctor pays for, the more they take home. So Norwood has been pretty good about keeping physician costs to a minimum with a lot of resources supporting them.
Yeah.
Okay, I lied. This is actually my lie. But it sort of feels like when you see athletes getting drafted younger and younger and committing younger and younger, I'm now starting to see communities posting doctors that are 2-3 years away from being able to practice. Is that something that you recommend as an option locally if we're struggling to find resources?
Well, that has been somewhat long-standing, years and years and years, and I might not have my numbers correct, but Belleville years ago was giving Queens students $50,000 a year towards their education for a commitment of time in Belleville after they graduated. So they were supporting their education with a contract that said they would come and work in Belleville. Now, what happened in some cases is once they start making good revenue, they just buy themselves out of the agreement and go where they want to work. So nothing's ever guaranteed, right? But certainly that has been a route that groups have taken, is to assist a student with their education with a commitment to come to the community when they're done. And I guess the plus there is coming to the community and loving the community is staying on. I know for Peterborough, our best recruitment is people who either come from this area or have family in this area. That has been the best recruitment tool.
Yeah, I agree. Okay, I think we're all done. But this was excellent. Thank you both very much. This is very timely, this update, and lots of good information. And I think we might have some things that we can maybe talk a little bit more sort of offline about as well too, and try to explore. But I mean, it's not all doom and gloom. I know it's a challenge, and it's not just here, it's everywhere. Like you said, it's across the provinces, across the country. We all know it. But if we can put our heads together and maybe think outside the box a little bit, we might be able to come up with some solutions. So thank you very much.
Well, whatever we can help you with that, is, doesn't conflict with, I guess, the rules that we're bound by, don't hesitate to contact us.
Wonderful. All right, Duff, Catherine, thank you so much. Can I have a motion to receive their presentation? Moved by Jim O'Shea, seconded by Colin. All those in favor? It's been received. And you have a wonderful day, guys. Thank you.
All right.
Thanks
thank
for
you.
having us.
Okay. So are we doing all good here? We can carry on. We're gonna move on for a little bit here. We'll get into the Peterborough County report, and I did actually pull up. So just a couple of things to highlight at our last meeting. It was last week. We got an update from Alexis Doyle and Daphne Herchbees about the Alto high-speed rail network, the big project talking about Toronto to Quebec City. Jim is not holding hope that he's ever gonna ride a train. But it's very interesting because the reality is that the stop in Peterborough is probably going to be somewhere in Peterborough County. And so there's a lot of there's still, it's early stages, right? It's still a ways out, but given that the federal government has those projects of national significance as well, this is, maybe something that, kind of is gonna loop into that and get some and get fast tracked a little bit. What else did we have? We also had, just a point of interest. We talked about longstanding service awards at the county level. They do it once a year around this time and they bring everybody together. I just wanted to note, and she is retiring this year, that she's director of corporate service now, was clerk for a long time. Lynn Fawn is retiring after 41 years. I thought Brian Weir had the crown with 35 years, but 41 years for Lynn Fawn, man. And was it this year? It said, yeah, she started when she was 12. So anyway, we got to acknowledge that significant milestone along with the others as well. And we did have some good discussion about some of the consent items, talking a little bit about, we had it at our last meeting, the incineration idea when it comes to waste management, as well as the recycling thing. So I got county council to move the same motion that we had about, if the producers can't figure it out, then maybe the province needs to reconsider having municipalities retake over the collection, and we'll just charge them directly, because we were already doing it effectively and efficiently. And what else is there? We renewed our insurance. We did some pre-approvals for tandem trucks for the plow trucks and stuff, and had some discussions about where we source them. And that may be coming up, Jason, on your discussion later on, with your report. But that's it, I think. I don't, Jim, if you have anything else to add?
No, you got most of it. Don't hold your breath for the high speed train. They need to get the land. They need to lay electric track. And, it was, how many kilometers? 1,000 kilometers. And,
Yeah, right.
one of the counselors,
Toronto, Quebec City.
is, really big on trains and so on and so forth. And, California, are into the, $16 billion mark, and they've done 15 kilometers of track.
Or something, yeah.
Trains. So, I mean, it's just, anyway, I think it's pretty much a pie in the sky, but, anyway, I'm not gonna worry about it. The only other thing, yeah, when you're riding, you think of me.
I'll be sending you a message.
And the only other thing was, the Rural Ontario Transportation Program, we put into, requests for money for it, that's all.
Or yeah, you're right. That's right. The Economic Development Reserve Fund, and then the budget for trade ready equipping rural entrepreneurs to compete beyond the county. Yes, that was right. Rhonda did present those two things. All right, so that's it. Any questions or comments? Otherwise, a motion to receive that report moved by Ruth Ann, seconded by Colin. All those in favor? That's been received. Colin, tell us about the status of where we are with our water.
So we are meeting in October. We haven't
Oh,
had an official full authority meeting recently.
Okay,
But we've also, the low water response team moved into level 3, which is a 30% reduction request in water. So that includes things like not watering your lawn if possible, not washing your vehicle, even taking shorter showers. It's getting to that point where you should be thinking about any way you can cut back on any water usage. Right now, our lakes are at winter levels or already below winter levels and continuing to drop. So it's gonna be an interesting fall, but the Crowe is certainly keeping their eye on it.
okay. Yeah, go ahead.
Can I just ask about, there was a communication done that we moved to level 3, and I don't know if you know or not, but I have got a bit of a big mouth. Telling people, right? You're supposed to reduce water 30%, which admittedly, when it went level 1, I didn't realize rural people were also supposed to reduce, right? So people are unaware that we're level 3, and they're unaware that they need to reduce water here. It's not just a municipal thing. Is there a way that we could perhaps communicate that maybe through the township or something, and then we could spread it?
I'll see if there's a social media document that's shareable.
There is one that I found, but it's rather, you know the one. I mean, yeah, if there was something a little simpler for people, because as we discussed, people read
Well,
briefly.
Yeah, it's just things like, you should be on a circulation list, and that's what, like, when I kind of heard about it sort of secondhand, I'm like,
Yeah.
well, were we circulated? Can we post it on our social media as well to let residents know, right?
And to let them know that they are part of 30% reduction, because there is confusion about that.
Just because you got a lake in front of you doesn't mean that,
You can see that
We
lake.
got water, cause we ain't got water.
And it is the lake levels
Yeah.
that the Crowe uses to determine these things.
And sorry, but that's also what I've been telling people is if you want availability for fire people to fight fires,
Yeah.
there's no pond, there's no, those
Yeah.
kinds of things. We need to worry about those levels, right?
And that's why I'm wondering, and it won't be a municipal responsibility, but the one thing that concerned me was when we had the fires locally,
Mhm.
we were already in level 2, I believe, at that point, trying to reduce water usage. And then people were going out buying fire hoses, dragging water
Yeah.
out of the lake to spray it on land. And it's like, oh, we're supposed to be like,
I know.
I also don't blame individuals for trying to protect their property and their resources. Like it's
And
an investment.
mitigate the risk, right? Yeah, no, I got it.
But it's that is one concern I had is the drier it gets, the more
Yeah.
people are gonna be tempted to start hauling massive amounts of water out of the lakes.
Mhm.
Yeah, yeah.
Just so you know, I mean, because I know the Crow is different, like we're part of we don't have the conservation area for most of North Kawartha, it's only the Shandos Ward. But the Trent Severn Waterway, and they have sort of their equal drawdown, like share the pain kind of thing. We are not at winter set levels, but we are close. Right, so it's, and no rain in the forecast.
Are all the logs out?
No, not at my lake, but
Okay.
they certainly were at early, they kind of slowed it down a bit. We had a little bit of rain earlier on, but the problem is that those isolated events where like, yeah, maybe, you know, for a couple day period, we got a couple inches of rain, but that didn't happen broadly across the region.
No, no.
And everything's so parched, just soaked it right up, so it'll be interesting to see, and then as we get into the winter and what the predictions are gonna be for that, because we need snow to fill everything back up. Or we're starting behind a very big 8 ball next year, so. Anyway, thanks for the update, Colin, and if there's no other questions, motion to receive that Crowe Valley report, moved by Jim O'Shea, seconded by Jim Whalen, all in favor? That's been received. Adoption of the minutes of the previous meeting. Can I have a mover to adopt those? Jim O'Shea, seconded by nobody. Jim Whalen. All those in favor? Those minutes have been adopted. Consent agenda items. Anybody want to pull anything out? If not, can I have a motion to receive the consent items? Since Jen, I should say, moved by Ruth Ann, seconded by Colin, all in favor. That's been received.
Oh, excuse me.
Oh.
The FoodCycler, I had a question.
Oh, no, that's coming up.
Oh,
that's not
okay,
part of the-
because it's in the,
No, it's not.
it's a letter, it's in the.
It's in the staff reports, which we're getting to right next. So hold on, because Gary's coming up. You only see his name right now, but there he is. Look at, he's popping up. And we're gonna talk about the sprinkler, jockey pump, emergency replacement, and the FoodCycler. Good morning, Gary. Welcome. Nice haircut. Please go ahead with your first report. It looks good.
Thank you. You caught me off guard. You made me choke there. Yeah, my wife told me it was time to get my ears lowered, so I did. But thank you very much. Good morning, everybody. The first report you have in front of you is for the unplanned replacement of the sprinkler system jockey pump at the NKCC. So this is a fairly sophisticated piece of equipment. It's not a pump that you can just, go grab off the shelf. It's a special order item. And, I'm sure everybody's read the report, so I won't get into all the details, but the jockey pump maintains a specific set pressure within our sprinkler system. It comes on automatically. We do daily inspections, both verbal and written. It's all, part of our fire safety plan of what we do. And we noticed this recently that the pump didn't shut off. And then all of a sudden it wasn't maintaining pressure. So we were able to get Troy to install us a pump that we had to work manually. So staff had to, monitor that water, that sprinkler pressure more than once a day, like several times a day. And then to run the pump as needed to stay within a specific parameters. So we had to go ahead and order the pump and get it replaced. And what I'm suggesting is that that was $14,675. So I'm suggesting that we reallocate $5,000 from the junior C dressing room plan that we originally had that looks like has been tabled for the foreseeable future. And along with $7,000 that we had planned to do a single coat at the Wilson Park tennis court. But after I had some further inspections with 10X Systems, by the way, he commented on what an amazing shape our courts are in. He goes, by gosh, you could run a tournament here. He said the courts are fantastic for what he sees. So rather than spend that $7 now, we did some remedial repairs and we'll move that farther on down the road and do a full 3 or 4 coat replacement in a few years. Sorry, I'm catching some background noise here. It's just throwing me off. So it would leave a balance of $2,675 plus HST to be transferred from general reserves. And that's it.
Okay, All right, Jim.
Curiosity, exactly give me a description of what a jockey pump is. Because if I'm wondering, I'm sure others.
It has nothing to do with a horse. It has nothing to do with the horse races. A jockey,
Doing underwear.
a jockey pump is it's a fancy it's a fancy name. It's an electric motor hooked up to a pump that looks different than what you would normally see. And that electric motor and that pump is all integrated into our sprinkler system. And it's designed to maintain water pressure in the sprinkler system. So God forbid, if that sprinkler system was ever activated, there is the water pressure that we demand and that we need in order to fight a fire.
Okay,
Just a quick question.
yeah, sorry, go ahead. Other
I
Jim.
got the idea. Gary, has the sprinkler system ever been used?
Oh, knock on wood. No, never. Knock on wood when we say that.
Yeah.
So
Um,
the pump is gone and was never used.
we test the the pump is used daily. So when you look at all the piping and all the sprinkler heads throughout the building, it's inevitable that you have pressure loss. Like there's always pressure loss. So that jockey pump will run 2, 3, 4 times a day in order to maintain that pressure. So yeah, it runs a lot. As far as the sprinkler system and its use, it gets tested as per the fire code. We have annual inspections, testing, and maintenance, and that's done annually. And if you come in, when you come into the lobby of the NKCC, if you turn to your right, you'll see all our certificates up on the wall there.
Okay. All right, well, good report. So there's a recommended motion there.
I'll move it.
Jim Whalen's gonna move it, Ruth Ann's gonna second it. All those in favor? Let's replace that pump. Okay, thanks, Gary. And your next report, please.
The second one, more exciting one, is the FoodCycler report. We apologize for the delay, but we had to find a way to improve how we implemented and delivered this program to our residents. Last year was the inaugural year for it, as you know, and at that time, shipping direct wasn't available. And, all the FoodCyclers had to be bought, paid for, shipped here. And then, people had to register and order them. And then they couldn't pay online. And then we had to approve that they were a resident. And then we had to collect money here. And then we created a couple dates. And then those dates didn't always work out for everybody. I'm going to go out on a limb to say that, I remember Jim Elder. I think it added a few gray hairs for him when we did it. And he said, by gosh, if I'm still around, we got to figure out how to deliver this better, right? So we did that. Now, any of our residents can go right online. They order a FoodCycler. We still have to verify that they are a North Kawartha resident, because this program is only provided to North Kawartha residents. And then once that happens, they order online, pay for online, it gets delivered directly. And even better, a little hiccup that a hurdle that we overcame was they can have it delivered to the address of their choice. So if they, just because if they're a seasonal resident, it does not have to be delivered here. Once we approve them, it can be delivered to their permanent residence, no matter where that is. So the FoodCycler is now only handled once. It's not handled or shipped twice. We don't even touch the FoodCycler. It gets shipped direct, paid direct. It's just a fantastic program. When we did the budget last year, of course, it's last fall, and and everything is based upon what we estimated shipping and the cost and everything was at that time. So there is going to be a shortfall. There may be, I'm not going to say there is, but there may be a shortfall of $1,700, which I've talked to Judy about just in case I require further action or reporting when we complete the program. But other than that, that's it. It's now, once we go live, it's all ready to go. And once we go live, it'll be fair playing field, whether you're a full-time resident or a seasonal resident. Because again, it's all online and all the advertising will be done through social media, our website, newsletters, communication plans, that sort of idea. Oh, if I may, one more thing, the only sort of, I don't want to say negative, but the only sort of, few negative comments we had back last year was towards the smaller FoodCycler. So that one was redesigned. They now have the Eco 3 and the Eco 5. One is a 3-liter, one is a 5-liter. And the Eco 3 is based on the same format as the Eco 5, just smaller. So it's going to be much better.
Excellent. Okay. Yeah, I fill up my 5-liter very quickly on a regular basis. So, yeah, Jim.
Mary, so the redesign, I hope it makes it easier to clean because, I got one of the early ones and, if you want to clean it out at some time, Jesus, it just,
Be careful what you put
really, it's a mess, It's
Depends.
underneath those things and so on and so forth.
Yeah. I find I let mine soak. If it gets like, if I get like
Yeah.
kind of a gross one for whatever, if it's super wet, I let it soak for a while.
The small ones though, the blades are, it's crazy,
Oh.
they're right on the bottom of it.
So it's hard to get
Yeah.
at.
Oh, yeah,
Yeah.
it's the little ones
Well-
are really impractical.
If it's been redesigned to more along the lines of the 5-liter, then
It works
it's, you can, I mean, I've been able to get mine pretty clean, but like I said, sometimes you just gotta let it soak for a while, right? But it's a great thing, I
Yeah,
love it.
I'm told the smaller one is it's basically virtually is the same as the 5, just of a smaller design. So I think some of the things that you mentioned, Jim, you probably won't find any. It'll probably be a lot easier to clean. We also have the accessory store right online now on our website, so everything can be ordered there. Warranty's 3 years now, which is another cool thing. So yeah, it's all good, and this is an expansion of 100 additional FoodCyclers, so it's first come, first serve. And as you know, last year we did 200. The first 150 went real quick, and then the last 50 was a struggle. But now that the word's out there and it's becoming a little bit more popular, I suspect these 100 shall go fairly quick.
Excellent.
Gary, do we pay upfront for the 100? Or what if we only sell 75 under this? They've still got 75 or 25 of them sitting in their warehouse.
Yeah, at the end of the day, we are on for all 100. But again, I don't see any issues why we're not going to get rid of that 100. But yes, we are. Because of the agreement and because of the pilot program and because of the drastic, reduction in price, we are on the hook for the 100.
Okay, thank you.
Okay. Yep, Colin.
Aside from people continuing to buy them, is there any way that we can sort of measure the success of the program? Sounds weird, but are we seeing a reduction in the organics collected at the landfill because people are doing it at home, or is there any way we can measure it?
That's a great question, actually. As you know, they have the survey that they ask people to do. So, you're supposed to track your usage for the first 12 weeks. And they do provide us the results of that program, like they did last year. But to actually tell whether, that, kept it out of our organics, like out of the the mullets at the transfer station or not. The only way we could go farther with that, I guess, would then to be to contact those 200 people or the 100 people and say, hey, listen, prior to this, were you using, the mullets, or were you taking your organics to the transfer station, or were you using a backyard composter, or is this, all brand new? So, what did they say again? They said each food cycler will divert at least 2 tons of food over its lifetime. But how much? And then it says here, based on this, 100 households could divert approximately 260 tons of greenhouse gas emissions. So we know it works. We know it's a benefit, but what Councilor McClellan is saying is how can we compare that, to what we were currently doing? How much has it improved it, or whatever. So I'll look into that farther. I just think that information would be it would be challenging to try to find or create.
Just as a very brief follow-up, I have no issue with ordering them and having them in sort of this batch of 100, but instead of adding money into the 2026 budget for it, I sort of prefer to have a communication, find out from people how the program's working before sort of upping up that again for another year after the.
Yeah, I'm thinking with the timing of this, like, cause we approved this for the last budget and the hundred's coming in now, I kind of feel like maybe it's gonna pause for 26. I don't know that we're gonna put monies in to get another 100 for next, like, let's see, cause of where we're starting with selling these, right? So we may just wanna wait on that, but we can discuss that more.
And I think part of it too is, how popular they become.
Yeah.
I mean, we're ready to release this, by gosh, they could go within the first week or two, right? So if that happens, then I think that has to be something said about, the food cycler itself, right? I haven't really had anybody call me and say, wow, this was a waste, I'm not using it, it's gone in the garbage, or, it's like that elliptical that you buy or that I bought anyway, and it's great for hanging clothes on, but it's not, so it's not one of those, right? I think that the people that buy these are probably like Councillor McClellan mentioned, either they used a composter before, they used the mullets, or they have a general concern, about the environment, and they want to do something to divert from our landfill sites.
Yeah, I think you're probably right, but I also think too, I think it go beyond it. Yes, I'm a big composter and I have been for a long time. We all know organics diversion is a minimum 50% reduction in waste going into our landfill, right? But I think it's the accessibility that this offers to folks, right? Who maybe don't have the ability to have a backyard composter, right? Don't live in the woods and can just kind of chuck it over the side. Cottagers that are worried about attracting animals if they compost, folks that, in more urban areas or whatever. So it's another way to do a good thing. And like I said, I love it. I mean, I still use my traditional composter anyway because of, gardening and all of that. But the fact that I can put food scraps and stuff in and make this super potent fertilizer for all my plants and veggies, I love it. So good on you. And we'll see what happens when you come back for budget, right? Where we're at with what's, what are remaining and whether or not we're going to look at doing more for next year. So, but we've got some time to figure that out, right? So anyway, excellent report. Thank you. If there's no other questions, can just a motion to receive the food cycler program update. Moved by Ruth Ann, seconded by Colin. All those in favor? That's been received. All right. Thanks, Gary.
Thank you, everybody. Nothing else. Everybody have a wonderful day.
Thank you.
Do we need to approve the transfer from general reserves for it?
We just moved or no,
Just received
We
it,
just received.
no, the motion was we just received it.
But it's already budgeted for.
but
But the
general reserves transfer.
What motion do you want, Gary?
The motion that we need right now is to approve the reallocation the two capital amounts in there, the 5,000 and the 7,000, that's in the recommendation. And the balance be transferred, sorry, I'm reading the wrong one. Oh my God. It's already been budgeted for, as as you all just said. The difference of $1,700, I don't think we need to address until the program is completed.
Okay. All right, perfect.
That
Yeah,
was the
if
direction
you-
I was provided.
Yep, okay, wonderful, thank you, we don't need to do another motion for that, we're covered, okay, that's great, thanks, Gary, have a great day, and Jason, you are
Yeah.
up next.
Fine.
You saved the best for last. Good morning.
Good morning, Madam Mayor, members of council. Thank you for your time. This morning I'm here requesting your approval for the purchase of 2 tandem plow trucks. The RFP went out and was closed on August 28th. The low bidder was Winslow Girolami Motors out of Peterborough. They met all of our evaluation criteria. They also were the lowest proponent. You'll notice in the report that I also recommended the purchasing the engine and after treatment system warranty. That's because we have 2 units in our fleet right now. We've had 1 unit, we've had to replace that system once. The other unit, we've had to replace it twice. And they're about $30,000 each time. So
Okay.
that's why the warranty is recommended in the report.
Mhm.
So the total cost that I'm recommending is $925,187.50. Since doing this report, I have had a conversation with the proponent, or the potential proponent.
Yeah.
And I just said, the cost seems a bit high. Is there anything we can do to still meet the spec that we had in there and reduce the cost a little bit? And they have indicated that if we pay for the cabin chassis when it arrives at Winslow or at Viking to be built, they will reduce the price per unit by $10,000. So I didn't have it in the report because this is kind of a discussion after.
Right. Okay. All right, Jim's already ready to go.
Where's the truck coming from?
So they're coming from Winslow's out of Peterborough.
Oh, I know that. Thanks, Jason. Canadian opponent.
Yeah, so no, I obviously because they had a tariff component in there in the item, I'm assuming some of the parts and pieces are sourced from the US.
Mhm.
But I think the systems right now are so integrated, I don't know that you'll be able to find a unit that wouldn't be totally Canadian built.
Is the factory in Canada?
That's a good question. I don't think the cabin chassis manufacturer is. The assembler for the plow system is in Canada. It's in Mount Forest.
We just approved 2 for the county and gave a pretty strong indication, even if they had to buy Volvos, buy something that wasn't made in the States.
I think, moving forward, it's something that we could probably look into including those in our tender documents, some kind of provision for Canadian sourcing.
Yeah.
But I think it would have limited us at this point. I don't think those systems are built in yet.
That's the challenge that, we discussed it at the county as well, is that because of that integration, we've had free trade for so long in that industry, right across North America. I don't know how, it's gonna take time to sort of separate it out. And there's also, and it's the balance of, wanting to support the Canadian, we are supporting Canadian companies. I mean, the importing and Winslow Girolami, like I said, local as well, but at the same time, we've also got to watch our dollars too. Like you say, buy something Volvo, but if it's double the price because we're importing it from Europe, like that's the other side of things too, right? This is a conundrum that we're all facing right now, and trying to make our way through. And also the challenge is that you're coming to us for something that's 2 years out, right?
Yeah, that's right.
Yeah.
Yeah, I think probably, the economy will balance itself out in a way, but like I said, we're so early into the issues that we're having with our trading partner to the south that I just don't think we're quite there yet, especially when it comes to these heavy vocational trucks.
Yeah, I agree. Jim and then Colin.
Curious question. What's the timeline for the warranty? How many years?
So the timeline on the warranty for the truck itself, so if you're thinking like bumper to bumper, like you would get on your car, they're about 12 months, unlimited kilometers. So any warranty you want over and above that, you have to purchase.
Right.
How about engine replacement?
So this warranty covers the engine replacement
For how
And-
long?
for 7 years.
Is that the normal lifetime for those engines?
No, the normal life cycle is about, well, these ones will be 12, 13 years old before we actually replace them. I think our normal life cycle is supposed to be 10 years. So, but I don't know that they offer those warranties. I didn't see anywhere in the documentation. So part of the tender, they had to provide any warranties that they have available on these units. And researching what they had provided us, there was nothing beyond the 84 months that I could see.
Yeah, it's pretty, a pretty long time for sure. Cause I think, was it like, I'm thinking when you purchase a car, it's like sort of like a 5-year kind of thing, and you can extend it to 6, so 7. It's, but yeah, there's a cost involved for sure.
There is, yeah.
Colin, sorry. You had your hand.
I think historically we've gotten a little more information in our request for tender when it comes to the staff report. It's at this point, without having the actual comparison from Curry, and it's not that I'm doubting that you went out to Curry at all, but it feels borderline like sole sourcing because we only have one source that we've been given an option to select from.
Right. So I can tell you who the other proponent was and what it was. So the other bid was 912,000 plus some dollars. I don't know the exact figure. So it'd be 912, say $500. They were a Freightliner dealer out of Barrie, or not Barrie, Bracebridge, sorry. With the same plow equipment and spec.
It's and same truck.
Yeah, same. They met all of it's a different manufacturer, but yeah, it met all the same provisions as Winslow did in Peterborough.
Yeah, and just jumping back to
Yeah.
Deputy Mayor Whalen there, if we have that information, we're able to do a little more research on or the companies, the manufacturers of the trucks, figure out if one is more advantageous locally. So just in future, I think it's worth putting the actual RFP grid right in the document. So
Yeah.
we can see the responses from people.
No, that's fine. Yeah, we can even, that's up to council. We can even, in future, we can put the evaluation metrics into.
Well, and I think the other thing is, and I'm sure I would expect that you'd be working with your colleagues across the county as well when we're looking at that, because we even talked about with the policies, our procurement policies about having, changing the wording on that, because even Jennifer Stover had said that, our preference is given for Canadian and that kind of, but we, if there are ways that we can tweak our procedures and our processes, so we know that the weight is given, and there is more transparency. It's not just for us, but it's also for members of the public as well too, that they can see that. But yeah, I'm with Colin. I mean, trust you, I have complete faith and confidence in your ability to pick the right one, right? But
I have complete confidence in you too, but we used to get it that would say, Winslow, Geronimo, I think there's X amount, and we can look across, and Curry this amount, we can look across and take a look at the differences and just one meets all the recommendations, blah, 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 blah. I know it's just words, but we've all been on council now for a while, so we understand that, but it was nice just to see the comparison, Jason. Okay, it's a little more work, I realize that, but it's something that, I don't know, it just gives you a better feeling when you know that this is a better deal. This is this is the way it should be.
Yeah, no, I'm fine with that. Yeah, in future, we can add those, like I said, we can add the evaluation matrix. We can put the pricing from both bidders.
Yeah.
I know verbally, I'm telling you, it's not in the report, so that's not handy for you.
Yeah.
But that was the bid.
Yeah. the matrix or the metrics or whatever you said
Metrics,
it would make sense because that's the other thing too, is that, you know, how things are weighted, right? At the end of the day, like I said, like our preference is for Canadian, but if the metrics is weighted, like the cost is the big part of it, right? You know, that's gonna trump where it comes from, right?
That's correct. That's what I said. In
Yeah.
future, you know, we would have to change some of our processes to, if we were gonna source from.
Yeah.
Canadian manufacturers.
Yeah, Alana.
Yeah, and I think it was already mentioned earlier, but the procurement bylaw will, and
Yep.
procedure will need to include if, you know, what we're permitted to do as far as sole sourcing from Canada.
So that may have to be changed because even the feds now are saying, you know, we're gonna,
That's right.
change it. So that we can say where it's coming from and, so on and so forth, so.
Yeah. I fully understand that. It's really hard with, it's really hard with tariffs right now because a lot of the tariffs are targeted to specific industries, which are like aluminum and steel.
Yep.
And so, like I said, we have assemblers that are here in this province. So you don't want, we want to be careful that we're not doing anything detrimental to the assembly process either, and affecting those jobs and workers.
Oh, listen, it's so integrated, as the mayor says, that, you know, it just, it's a son of a gun of a thing. I mean, let's face it, so somebody, has really thrown a monkey wrench into the whole thing.
Somebody.
I forget his name.
Yeah.
I forget his name.
Hey, well, we don't need to go there. Anyway, there is a recommendation.
This trumps it anyway.
Yes, oh, sorry, yep, go ahead, Jim.
Where is Curry Truck Center located?
Bracebridge.
Okay.
Yep.
All right, so the recommendation is there. Can I have somebody make that recommendation, move that recommendation? Moved by Colin, seconded by Jim O'Shea. All those in favor? That is approved. Thanks, Jason.
You're welcome. Thank you, members of council.
Jason.
Okay. And moving right along, we have staff report administration, and this is something that we had discussed, I think at our last meeting as well, the change that has come down. And it's provincially driven, that's right, isn't that right, Kelly? About, we don't need to, what is it there? We don't have to call, or we don't have to post notice for if we need a council meeting during an emergency, right? That's what it is. Okay, so it's just like a minor housekeeping thing that we gotta do, so we're in compliance. So the recommendation is just to adopt the bylaw at the end of the meeting. Moved by
Recommendation.
Perfect, moved by Jim, seconded by Jim Whalen, and seconded by Ruth Ann, all in favor. That is approved. And memorandum of understanding with the Ontario Federation of Snowmobile Clubs.
Didn't make me happy, I think.
Oh, there you go, Evan is here. And let's hope we get some snow, so this, this is.
Let's hope it's not.
Good morning. Yeah,
Yeah, go ahead.
so this recommendation is to authorize the clerk to sign an MOU with the OFSC Eastern area. So the amalgamation of the two local snowmobile clubs that will be taking care of the leases and agreements moving forward on the section of parcel along Winters Bay Road. So this is one of the few sections that we don't have an updated MOU on in terms of active trails that are on municipally owned lands. Just as in regards that there are plans to do work on this section of trail this fall, so the MOU will be put in place to acquire insurance for that work to be completed this fall, so.
Okay. All right, questions, comments? Would you like? Do you want to move that? Okay, is there a seconder for that? Seconded by Colin, all those in favor? That is approved. Okay, like I say, fingers crossed we have some snow this winter.
There's no long sit.
Not as much as last year though. Anyway, okay, and then moving on, we are down to the bylaws and Tony, could you read out the one bylaw, I guess it is?
Madam Mayor, so we have one bylaw, which is a bylaw to amend procedure bylaw 2025-0050.
Okay, can I have a mover for that bylaw, please? Moved by Colin, seconded by Ruth Ann, all in favor. That is approved. Motion to confirm proceedings of today's meeting. Moved by Jim O'Shea, seconded by Jim Whalen, all in favor. And motion to adjourn, please. Moved by Colin, seconded by Jim, thirded by Ruth, and fourth by Jim. We are adjourned, people. Thank you.